Well, cases of whooping cough continue to grow, especially here in Pennsylvania, with some of the highest numbers we've seen in several years.
Well, the reporter Stephanie Stahl joining us now with more on protecting you and your loved ones from this growing trend.
This is making a big comeback, guys. You know, this is a bacterial infection that spreads through the air, much like flu and COVID. Doctors say the best way to guard against whooping cough is with a vaccination. Whooping cough cases are 5 times higher now than they were this time last year, according to the CDC. In Pennsylvania, numbers are 10 times higher. So far this year, there have been 2,008 cases of whooping cough. During the same period last year, there were 190. Numbers in New Jersey and Delaware are up, but not as dramatically.
And that's even before we really enter respiratory virus season, where, I think that we're going to see even more cases as we go forward.
The bacterial infection, also called pertussis, is most dangerous for high-risk groups, including the elderly and young children.
About a third of infants will get hospitalized, and actually about 1% of infants that develop whooping cough will actually die from the infection.
The CDC says early symptoms can mimic a common cold. 1 to 2 weeks after those start, there can be rapid, violent, and uncontrolled coughing fits that can make it hard to breathe, and patients can suffer for up to 10 weeks.
They can kind of get blue in the face, and then there's a very sharp intake of air that kind of causes this whoop.
Doctors say the best protection against whooping cough is vaccination. That's typically given to children. There's also a booster for adults, and it's especially important for those who are pregnant.
Remember that infants very highly rely on their mothers for their immune system over those first 6 months of life.
Now, doctors say the effectiveness of the pertussis vaccine can wear off. That is why boosters are important for adults, especially if you are going to be around those at risk. So some people say whooping, some people say hooping.
Yeah.
Hooping is preferred, but whooping is okay.
Hooping is preferred.
Just in case you were wondering.
I know. I was wondering because I was wondering because he said whooping, you said hooping, and I would have.
And when in doubt, pertussis.
There you go. Can't go wrong with that one.
Thank you, Steph. We appreciate it as always.